Our cases over the last 14 days is 1,030. That brings our average cases per day to 74. So 2.5 weeks ago, our average daily cases was 45. So we have seen quite an uptick in the number of cases per day. And you can also see our total deaths, which is 370 since the beginning of the pandemic. The average cases per day, that uptick, I'll be able to show you in a few slides where that uptick is coming from as over the past several weeks. Next slide shows our cases per day over the last 14 days, and this is cases per 100,000. And you can see that we're starting to see that uptick that I mentioned over the last few weeks since late March, early April, where our cases are starting to go higher per day. This next slide, this is showing you where our cases are coming from. Over the last two periods, 2 weeks, from 4/4 to now 4/17, you can see that our cases are in that 15 to 24 year range. That's our highest number of cases. And then you can see the 25 to 34 year olds is the second highest number. And then 35 to 44 year olds is the third largest. So those three groups from 15 to age 44, young teens and young adults is where we're seeing the highest number of cases now each week over the past 2 weeks. On the left, you can see it broken down by age. And you can see that those that are 65 and over, the vast majority have been fully vaccinated. But then when you get into younger populations, you see a smaller and smaller percentage of individuals that are fully vaccinated by age group. And that's where our focus is, we see in the next weeks and months, is getting individuals the vaccine, especially in that 18 to 49, those two age groups, making sure that they are more and more vaccinated. We're seeing the 50 to 64 year age group go up each week, but we still have to get that age group, the majority vaccinated in that group too. Going forward, the key is getting our young adults, as I've already mentioned, vaccinated. And again, this is not just, there's the hesitancy we've seen, and we're trying to provide education about that. But now the big thing is that urgency. We all want to get back to normal. We want to get back to events and get-togethers, and just, really we're about to get to summer and just having a normal summer. And we really need to get more and more and more people vaccinated, especially those young adults that have those lower percentage in those age groups of vaccine. And we're continuing to market to this age group and working with a media company to provide marketing that really appeals to our younger demographic. Yeah, I mean, we are, I think that's true. I mean, we are reaching a point. I think we're very near that point for all those that want it, haven't gotten it. I think we may have reached that point already, but we're still seeing people come in for appointments, but it has slowed down significantly. So I think the key point is, one, I think there's some people that they want it, but they're just kind of like waiting. There's vaccine available, so now it is the time to get it. We're trying to, we're experimenting. We have Saturday morning hours, we have evening hours, so we're trying to make it as accessible as possible. It's a 30-minute process, start to finish, and that includes the 15-minute wait. So it's a pretty quick process. So now is the time to get it, because we all, like I said, we want to get back to the normal summer, the normal events, and things like that. So we're really pushing and encouraging people. If you've been on the fence, now is a good time to do it. If you've been waiting, don't wait any longer. Go ahead.